Today, we'll go over the background and objectives of this survey, along with the methods, spending most of our time on results, promising practices, lessons learned, and implications for policy, practice, and future research. Partial and full integration of campaigns has become increasingly relevant for all program areas in recent years. However, there have been limited studies addressing the actual size and scope of integrated health campaigns and the most common barriers and facilitators to integration across all health programs. Our study had three objectives. One, to assess the frequency, facilitators, barriers, and opportunities for full and partial health campaign integration in low and middle income countries. Two, to generate a data set of fully and partially integrated campaigns, identifying and collecting data for additional variables to potentially add to the campaign calendar database and improve our existing tools. And three, to explore data from global level partners and compare it to data from country level campaign managers, highlighting gaps that could impact future work and increase knowledge sharing around health campaign integration practices. We designed our research questions to gather information about four thematic areas. One, reasons for integration. Two, characteristics of campaign integration. Three, facilitators and barriers. And four, collaboration and digitization. Of note, for the purposes of this study, we defined partial integration as campaigns involving collaboration or coordination around common inputs, data, tools, or processes. Full integration, or co-delivery, requires the delivery of two or more products at the same point of service. Moving to methods. This was a mixed methods study with retrospective and prospective quantitative and qualitative data. Linksbridge conducted a desk review, survey, key informant interviews, and a data validation exercise with stakeholders across different health domains and functional areas. The desk review included a review of all data from 2019 through 2021 in the campaign calendar, as well as the archived campaign media monitoring stories from April 2019 through 2022. The survey was developed to reach campaign managers and implementers using a snowball sampling method. More details on survey respondents and questions can be seen later in the presentation. All survey respondents were invited to participate in both a 30-minute KII, or key informant interview, and a data validation exercise. For those of you who want to do your own research in the campaign calendar, media monitoring, or the results of the survey, please visit the Campaign Effectiveness website. Findings from the study can be found in the special dashboard section of the page. Getting into results, we would like to quickly touch on the desk research before spending most of our time together on survey responses. Please note that while this presentation will cover results fairly quickly, you are welcome to dig deeper into any finding of interest using the website dashboards. The campaign data review revealed that integration is commonly occurring with measles-containing vaccines, polio, and vitamin A, and an afro. Nigeria and Pakistan reported the highest number of integrated campaigns during the time period reviewed. Our review of media monitoring revealed similar integration trends. Of the 550 stories, 61 included integration, with measles, polio, and vitamin A occurring the most frequently. Moving on to the survey, a snowball sampling method was used to deploy the online survey link to 143 individuals. Of those individuals, 49 initiated the survey and provided their information. 47 respondents then went on to answer the first question, with 35 answering the majority of survey questions. For analysis, we grouped survey respondents into 6 regions and 1 global or unknown location category. Respondents worked in a number of disease areas and in multiple roles, such as immunization advisor, program director, and technical officer. The first batch of survey questions were around reasons for integration. In survey responses, the most frequently selected rationale for campaign integration, full or partial, was to reach coverage targets more efficiently. As mentioned in KIIs, integration can also be key for reaching hard-to-reach communities and zero-dose children. While the decision to fully or partially integrate is complex, respondents did report that partial integration is occurring frequently, as well as full integration. This is a sampling of campaigns reported as full or partially integrated in respondents' countries or programs. As you can see on the slide, many different types of programs integrate. A wide variety of other combinations were also reported, with partial integration sometimes happening among up to 4 programs. When asked what factors facilitate integrated health campaigns, survey respondents most frequently cited same target populations, government buy-in, donor, partner, and government coordination mechanisms in place. Moreover, for partially integrated campaigns, respondents also added appropriate and achievable timelines and the presence of data management and collection systems to the above list. Specific examples of successfully integrated campaigns also made reference to the alignment of technical skills and incentives. Expanding upon the previous slide, respondents noted that some geographic areas and programs are easier to integrate than others, noting that geographic areas that share the same culture, religion, and weather, interventions requiring little to no technical skills for administration, and similar target ages and acceptability of interventions being key for integration. Survey respondents ranked the top 3 barriers differently for full versus partial integration. Overall numbers show that poor communication or coordination between donors, governments, and other partners, human resource constraints, and lack of government buy-in at the top of the list of barriers. Of note, several participants specifically called out circumstances where integration was not advisable, including conflict, emergency, or outbreak response settings. In these cases, urgency and short planning timelines made integration less feasible and desirable for implementers. Nearly all survey respondents confirmed that there are campaign coordinating bodies or an integration work group in place when integrating activities. This collaboration happens between many different groups, including government, development partners, community leaders, and technical working groups. As one key informant put, integration of health campaigns is not something to be done ad hoc and must be well planned. According to survey respondents, the highest level of collaboration occurs in training, engagement, and recognition of campaign staff, coordination and microplanning, and social mobilization and communication. The least amount of collaboration occurs during the evaluation and surveillance processes. For integrated campaign activities, over half the respondents reported some elements of digitization. The most frequently cited uses were data collection and reporting. Lack of infrastructure and poor resourcing were identified as digitization barriers. In addition, as mentioned by a key informant, digitization efforts can be hampered by unsupportive country policies. Overall, participants were supportive of integrated campaign activities. The national health policies and strategies should include integration where possible. Before wrapping up this presentation of results, we wanted to provide a quick note on our data validation exercise. Where campaign calendar data is collected from global partners, this exercise helped identify potential gaps in relying on information from global partners rather than directly from campaign managers. Two promising practices emerged from this study. One, we should support the development of national health policies and strategies for integration. As shown in other findings, government buy-in and coordination is very important for integration. Respondents viewed the inclusion of integration in a country's national health policy or strategy as a key opportunity for success. And two, whenever possible, collect and defer to data from country-level partners. While global systems do collect data on upcoming campaigns, the most robust information about what is occurring and how it is being planned can be found at the national or subnational level. By engaging country partners in campaign data sharing, campaign planners across sectors will have timely views into upcoming campaigns and create opportunities for improved coordination and integration of campaigns. When asked what 3 things they would do to promote integration, survey respondents emphasized the importance of establishing coordinating bodies for defining roles or harmonizing plans, using digital tools to harmonize microplans, macroplans, social media strategies, and data collection, and sharing resources that can be used as common inputs, such as population enumeration, waste management, and financing. Additionally, key informants echoed the importance of considerations such as ensuring alignment between key agencies with local entities to promote integration, utilizing services like community health influencers, promoters, and service programs to increase the acceptability and frequency of integrated activities, implementing human-centered design approaches to implementing integration. Finally, When considering future iterations of this research, there are several activities the team could consider. One is adjusting the deployment strategy by utilizing the new list of country campaign managers. The second is the scope of the survey. There seem to be several additional areas that are of further interest to the global health community, such as digitization, and the team does recommend adjusting the survey to more comprehensively assess these additional research areas. And third, logistics. We suggest extending the survey open window from 3 weeks to 1 month to encourage a larger response and offering the survey in several different languages to enable broader participation. Thank you again for participating in our study and in this overview of our survey. Again, all information and data can be found at the Campaign Effectiveness website. And thank you.